Have you ever wondered why that one itchy spot just won't go away even after trying every lotion, keeping clean, and switching soaps? You're not alone. Many people in their 60s, 70s, or even 80s have experienced the same thing: a persistent itch with no rash, no clear reason, and worst of all, it just doesn't stop. At first, it's easy to think it's just dry skin, or maybe the weather, or aging, or maybe your shirt was a little too tight that day. But sometimes that itch isn't so innocent. Sometimes it's the body's first quiet whisper, a subtle way of saying something's not right. And if we listen closely, really listen, we may catch something far more important before it grows into something we can't ignore. In my 20 years of working with older adults across the US, I've seen this story play out again and again. People like Mr. Walter in Ohio, age 74, or Ms. Doris in Arizona, 68. They thought it was just a typical itch. But after a few weeks, when they finally went to see a doctor, the results were shocking. Early-stage skin cancer, lymphoma, or in some cases, pancreatic cancer that had already begun to grow silently without any symptoms except for that one stubborn little itch. Now don't worry. I'm not here to scare you. What I truly want is to help you notice the small things, so that you can take control of your health, ask your doctor the right questions, and most importantly, not miss the golden opportunity to prevent something far worse. You see, when we're young, our bodies respond loudly. Pain feels like pain. A fever makes us stop, and it goes away in a few days. But after 60, the signals change. The body no longer shouts. It whispers, softly, quietly, subtly, and if we're not paying attention, we miss it. So in today's talk, I'm going to walk you through 5 very specific areas of the body. Spots where persistent itching has been repeatedly linked by US doctors to serious forms of cancer. Ones that often show up long before other symptoms. Ones that are easy to mistake for something harmless. Each location will be explained in simple, easy-to-follow terms. And I'll share real stories from real people like you and me. So you can relate and, more importantly, know what to do if something feels off. If you're still listening at this point, I encourage you to stay with me until the end. Because sometimes it's the smallest thing you learn today that could change the entire course of your health tomorrow, or even save the life of someone you love. And if you find this helpful, feel free to follow or subscribe to my channel. Each week, we'll explore practical tips, simple insights that might just save a life. Because sometimes what saves a life isn't expensive equipment. It's simply paying attention at the right time. Let's get started. 2.5 Persistent itching signs that may point to cancer. 1. Itching around the anus or genitals, a sign often overlooked. If there's one area of the body people feel most uncomfortable talking about, it's the anus and genitals. And for older adults, it becomes even harder to bring up. Many choose silence. They just deal with it and hope it goes away on its own. A bit of itching in the private area is often blamed on rough toilet paper, poor hygiene, tight underwear, or simply thinning skin due to age. Some even think it's caused by spicy food or sitting for too long. But here's what many people miss. When the itch lasts, when it lingers, and when it starts to feel more like a burning sensation with rough skin, or like something's constantly rubbing inside. That's a red flag. It may no longer be just an itch. It could be an early warning sign of cancer. One type of cancer often diagnosed late in older adults is anal cancer. Unlike colorectal or stomach cancer, anal cancer usually doesn't start with pain. There's no clear lump, no bleeding, no obvious signs, just a mild itch. Vague. Sometimes it shows up once or twice a week, then fades. But then it returns. More often, lasts longer, and starts to become a real nuisance. We once met Mr. Harold, a retired engineer, 76 years old, living in Minneapolis. He said the itch began near the end of last winter. At first, he thought it was just dry skin from the cold weather. Then he suspected the wool pants he wore every day. He tried different lotions, applied ointments, even ate more vegetables thinking it might be digestive. But strangely, no matter what he did, the itch didn't go away. It stayed in one small spot, right near the anal canal. By month 8, he finally saw a doctor. That's when they found a small lesion, almost invisible to the naked eye, deep inside the anal lining. A biopsy later confirmed it was early-stage anal cancer. Luckily, because he came in early, the tumor was still small, hadn't spread, and the combination of radiation and surgery brought a good outcome. Mr. Harold's case isn't rare. Among women over 60, persistent itching around the genital area may also be linked to vulvar cancer, a rare condition, but one that's becoming more common in this age group. And once again, the first symptom is not a lump, not pain, but itching. Itching around the outer vulva. No rash, no visible irritation, but it keeps coming back, especially at night. Many women think it's just hormonal changes after menopause, or vaginal dryness, or just aging. But if the itch keeps coming back, doesn't respond to creams, and the skin starts to thin out or change color slightly, that's when it's time to get a full checkup. In men, penile cancer can also begin with one simple symptom: itching in one specific spot. No pain, no swelling, nothing unusual to look at. Just a slightly uncomfortable area, as if something is constantly brushing against it. But because of embarrassment, many choose to ignore it. And sadly, by the time they go in, the condition has progressed. Why is this area one of the first to send signals? Because it's packed with nerve endings. Even a small change in the cells below can trigger sensory nerves, and that signal travels up as an itch. 2. Localized itching on the chest or breast area, a sign few people consider. For many individuals, especially women over the age of 60, the chest is an area that goes through frequent changes. The skin can become thinner. The milk glands are no longer active, and the skin around the breast becomes more sensitive to temperature, fabrics, or even laundry detergent. So when there's an itch on the chest, most people assume it's something simple. Maybe it's sweat, a tight bra, or just dry skin from the changing weather. But if you notice that the itch stays in the same spot, keeps coming back, and doesn't go away even after using lotion or changing bras, it may be an important signal you shouldn't ignore. Itching around the chest or nipple can sometimes be an early sign of inflammatory breast cancer, a rare but aggressive form of cancer that grows quickly and doesn't follow the usual rules. Unlike most breast cancers where you might feel a lump, inflammatory breast cancer often starts quietly, with very subtle changes. The skin may feel slightly thicker, warmer, a bit red, and it itches frequently, not all over the body, just in one specific area. One side of the chest, around the nipple, or just beneath the crease where the bra sits. I once met Ms. Linda, 69 years old, living in Denver. She told me the itching began in spring. It was mild, on her right breast, just below the fold. She switched bras, used a gentle soap, and applied moisturizer every night. But the itch didn't go away. In fact, it became more irritating over time. And strangely, it always returned to the exact same spot. No rash, no bleeding, no lump to feel. Just a restless sensation under the skin, like something was pressing upward from the inside. After nearly 2 months, Linda went to see a dermatologist. The doctor examined the area closely and found a slightly thickened patch of skin with a small indentation. A biopsy confirmed early-stage inflammatory breast cancer. Inflammatory breast cancer often grows closer to the skin's surface than other types. And what's worth noting is the itch often comes before any other signs appear. No lump, no visible swelling, just a change in the skin and a persistent itch. This is why so many people overlook it. And not just women, men can get breast cancer too. It's rare, but it does happen. And just like in women, the first sign in men might be an itchy patch of skin near the nipple or an area that feels slightly thicker, a vague feeling. But it keeps returning and doesn't go away. If you're in your 60s, 70s, or 80s and notice something odd, even if it's small, even if it's not painful, but it lingers, it's worth bringing up with your doctor. Lymph nodes under the arm or just below the collarbone can also cause itching in the chest. In some cases, this can be an early sign of lymphoma, a cancer of the lymphatic system that's more common in older adults. Itching along with a heavy feeling in the chest or slight swelling in the armpit, even if it doesn't hurt, could still be the body's way of sending a message. The key point isn't that itching always means danger. It's that when itching happens again and again, with no clear reason, and doesn't respond to regular treatments, that's when it's time to pause and listen to your body. Because sometimes what seems small is actually the first bell ringing to let you know something bigger might be on its way. 3. Itchy scalp without dandruff when a small sensation could mean something much bigger. We often don't think much about the scalp, especially as we age. Having a dry, slightly itchy, or mildly irritated scalp becomes a normal part of life. Who hasn't felt that from time to time? Maybe it's the cold weather. Maybe it's from wearing a hat too long, or a shampoo that just doesn't suit your skin anymore. But if one day you realize that it feels different, there's no dandruff, no flaking, no redness, no rash, yet it won't go away, even after switching shampoos, using scalp treatments, or even washing less often to reduce irritation. Then it's time to pause, because it might not be just a simple itch anymore. A persistent scalp itch, especially a deep one that feels like tingling, slight burning, or seems to move from spot to spot, could be an early sign that something is going on beneath the surface or even in your blood. According to hematology experts in the US, this kind of itching is often seen in people with chronic lymphocytic leukemia. In some cases, it's also the first sign of skin cancer on the scalp, especially in areas where the hair is thinning or the top of the head is often exposed to sunlight. I still clearly remember Mr. Charles, age 73, from Oklahoma. He was active, loved walking every afternoon, and always wore his favorite baseball cap when outdoors. He said the itch started slowly during the summer. At first, he thought it was from sweating, then figured it might be a new shampoo his grandson bought by mistake. He switched back to the old brand, but the itching stayed. He tried washing every other day, used shampoo for sensitive skin, even cut his hair shorter to stay cool. But strangely, the itch never really left. It didn't spread across his head, it just kept moving slightly around the crown area. It felt like something was crawling beneath the surface of his scalp. No pain, no swelling, just a constant low-level discomfort. And most importantly, it didn't respond to any of the scalp products he tried. Finally, during a routine blood test, his doctor noticed an unusually high white blood cell count. Further testing confirmed Mr. Charles had early-stage chronic lymphocytic leukemia. The itchy scalp, something he thought was just a minor skin issue, was actually his body's first signal. In other cases, scalp itching can also be an early warning sign of skin cancer, especially in areas where the scalp is exposed to sun, like the top or back of the head. A tumor may start very small, just a dry patch, or a slightly rough area of skin. No swelling, no bleeding, but it stays itchy in that one exact spot for weeks. Often, the person doesn't notice it themselves. It's a partner, a family member, or even a barber who points it out. What matters most is this: don't underestimate a nagging sensation. When we're younger, an itch is just an itch. But past 60, the body doesn't send loud warnings anymore. It speaks softly, and sometimes it uses an itch to gently whisper that the immune system is responding, that something might be changing in the lymph system, or that skin cells are shifting in ways we haven't yet seen. If you notice your scalp itching for no clear reason, no dandruff, no rash, and it doesn't respond to anything you've tried, don't brush it off, because sometimes the smallest signal carries the biggest meaning. For itching between the shoulder blades or upper back, when the itch comes from deep within, between the shoulder blades, right in the upper back, a spot most of us can't reach on our own. It's also a place where, if it itches, we usually think it's just a rough shirt, some trapped sweat, or maybe leaning against a chair for too long. As we get older, that discomfort in the back tends to happen more often. The skin ages. It holds less moisture, and it's easy to think it's just another part of getting older. But if this itch feels different than usual, if it doesn't go away, if there's no rash, no bumps, no clear reason, and yet it sticks around day after day, then maybe your body is sending you a quiet signal that shouldn't be ignored. In recent studies from major medical centers across the US, experts have pointed out something surprising. Pancreatic cancer, even though it's deep inside the abdomen, can sometimes cause itching in the upper back, especially between the shoulder blades. It sounds strange. The pancreas sits far beneath the stomach. How could it affect the skin on your back? The answer lies in a very specific biological chain reaction. As a tumor grows in the pancreas, it can press against the bile ducts, those narrow tubes that carry bile from the liver into the small intestine. When those ducts get blocked, bile salts can't flow normally into the digestive system. Instead, they start leaking into the bloodstream. Once in the blood, those bile salts circulate throughout the body and begin to irritate the sensory nerves under the skin. And the area they often affect most? The upper back, where many of these nerve endings are concentrated. Mrs. Margaret, 70 years old and living in Seattle, is a perfect example. She said that in early fall last year, she began to feel itchy in the middle of her back. Not a lot, but enough to make her scratch each night before bed. At first, she blamed her old mattress, then thought maybe it was a new laundry detergent. She changed her mattress, switched detergents, applied lotion morning and night. But the itching never went away. And the strange part was it only ever itched in that one spot. It didn't spread. There was no rash, just one area with a mild but persistent discomfort. Mrs. Margaret shared that it wasn't the intensity that worried her. It was the way it stayed in the same place and kept returning. After more than a month, she saw a doctor. Her blood test revealed elevated liver enzyme levels. An abdominal ultrasound and CT scan found a small tumor at the head of her pancreas, pressing gently on the bile duct. Diagnosis: early-stage pancreatic cancer. What's most notable is the itch was the very first sign. No stomach pain, no yellowing of the skin, no digestive issues. Just one itchy patch on her back that wouldn't go away. Itching caused by internal issues doesn't behave like typical skin irritation. It doesn't come and go. It stays. And it feels like it's coming from deep beneath the surface, not just on top of the skin. Of course, not everyone with an itchy back has cancer. But if you've tried everything, changed clothes, applied creams, switched detergents, and nothing helps, especially when the itch stays in one fixed spot for more than 2 to 3 weeks, then it's time to take a closer look. Because sometimes, something as simple as an itch on your back might be the first early bell, telling you something important is happening inside your body. 5. Persistent itching in the lower legs when your legs speak on behalf of your blood. If there's one place that tends to itch without raising concern, it's the lower legs. The shins and calves are often exposed to air, clothing, and the environment. So when they feel dry or slightly irritated, we usually blame dry skin or simply aging. In reality, the skin on our legs, especially for those over 60, loses moisture more easily. And blood circulation in the lower part of the body doesn't work as efficiently as it did in our younger years. That's why, when itching shows up, most people don't think much of it at first. But then it doesn't go away. There's no rash, no redness, no bug bite. And what's more, it tends to itch more at night. So if you've tried lotion, haven't changed soaps, aren't wearing wool, and the itch continues in the same spot, it's time to pay closer attention. Because sometimes the real issue isn't in the skin. It's deeper within the lymphatic system or the blood. Deep, persistent itching in the lower legs, especially without any visible skin changes, has been documented as one of the early signs of lymphoma, specifically Hodgkin's lymphoma. The lymphatic system plays a key role in immune function. When a type of white blood cell multiplies abnormally, it doesn't just affect the lymph nodes. It also releases inflammatory chemicals into the blood, triggering a reaction that causes deep itching in the skin tissues. Many patients describe the feeling as if something is crawling under the skin of their legs, not on the surface, but deep underneath. I once met Mr. Raymond, 75 years old, living in New Mexico. He shared that he began itching on both shins every night, especially when he lay down. At first, he thought it was poor circulation or tight compression socks. But after switching socks, changing mattresses, using lotion, and even trying a different vitamin D supplement, nothing changed. The itch didn't come and go. It stayed. Mr. Raymond tried everything: scratching, applying oils, using cold water, but nothing worked. Eventually, after a general checkup, his doctor ordered a blood test. And that's when they found an abnormally high count of lymphocytes in his blood. A biopsy of a chest lymph node confirmed early-stage Hodgkin's lymphoma. The strangest part? The itch in his legs was the first and only symptom for months. Not every itch is cancer-related, but cases like this remind us that the body has its own way of speaking to us. Sometimes, it doesn't use pain, or swelling, or fever. It uses something very ordinary: itching. So if you or someone you love finds themselves scratching their legs every night, trying every cream with no relief, no bug bites, no new products, then remember this. When the body no longer shouts, it whispers. And sometimes it's the legs that speak first. 3. Conclusion: listening is the most powerful choice. Sometimes, our bodies don't sound the alarm with a loud bell. They don't shout. They don't bang on the door. They just whisper. A light sensation on the scalp, an unusual itch on the leg, a vague discomfort in the middle of the back. And if we're rushing through life, if we believe it's just age, if we brush these signs off as nothing, it's easy to miss them. But you know what? The body never does anything by accident. It is the most intricate system nature has given us. And itching, just like pain or fatigue, is its biological language. It's how the body tells us that something is changing inside. Maybe it's small. Maybe it's not urgent. But it still deserves to be heard. Especially for those over 60, changes in the body tend to come slowly and quietly. Cancer, chronic inflammation, immune disorders. They don't always begin with clear symptoms. Not every cancer starts with a lump you can feel. Not every illness brings blood or sharp pain. Sometimes, it begins with a dull feeling, a small discomfort that's easy to ignore. So when you feel an itch that lasts longer than 2 to 3 weeks with no clear cause, that doesn't go away with lotion. That's not from a bug bite or new detergent. See it as an invitation from your body. Please get me checked. After spending 20 years helping older patients across many states in the US, I've seen it all. One persistent itch saves someone's life. A 74-year-old man discovered pancreatic cancer thanks to a small itchy patch on his back. A 68-year-old woman survived aggressive inflammatory breast cancer because she didn't ignore the itching around her chest every night. An elderly man itched both legs for 5 months. Turned out to be lymphoma. Found early. Treated on time. This isn't about fear. It's about showing that small things can carry big meaning. And early detection is one of the greatest gifts you can give yourself. If you feel something different in your body, even the tiniest shift, trust your instincts. You don't have to panic, but don't brush it aside either. Waiting too long could mean missing the chance to act in time. So talk to your doctor. Write down what you're feeling. Keep an eye on it. And above all, don't stay silent. You know something? Good health doesn't only come from medicine or diets. It begins with listening, with respecting the small signals your body sends, with caring, gently, without forcing yourself to just deal with it. If you found this message helpful, for yourself or someone you love, don't hesitate to share it. Because sometimes, a short video, a single article, or a few words at the right moment can change the path of someone's life. And if you'd like to stay with me on this journey of proactive health, where we listen to our bodies, understand them, and care for them with kindness, go ahead and follow the channel. Turn on notifications so you don't miss what's coming next. Because you deserve a healthy body, and your body deserves to be heard.